want to talk to you about my perspective and reflection on the reading of this week. We started with the first question, what are the main points of the reading? From this text, I gathered that migration must be understood as a complex and dynamic process with deep implication in public health that extend far beyond individual behaviors. In the first point, we have the article by Zimmerman that actually presents a comprehensive framework that divides the migratory process into several phases, like pre, departure, travel, destination, interception, and return. Each phase presents a unique health risks and opportunities for intervention. This is importantly because this article stresses that policy-making of the migration and health must go beyond siloed approaches requiring across-sector coordination. In the second point, the article by Evans offers a historical perspective that showing how migration and health have been interlinked over time. Evans explained how the migration was once a major public health issue, for example, with screening for disease among immigrants, and highlights the how changing migration patterns like the emergency with AIDS. This context has reshaped public health responses. In the last point, we have the article by Harry Knipe. This focuses on the contemporary migration patterns and the associated with this risk. This text outlines how global migration affected by economic disparities, political crises, and environmental factors, and brings significant health risk. It also calls for addressing migrant health from the perspective of human rights and equality, emphasizes that migration is not only about individual choices, but is deeply embedded in the structural inequalities. The second question, was anything unclear, confusing, and why? Although I think I have a familiar sense of these topics from the previous lessons and the segments, but some aspects still left me with questions are these ones, like the integration of multiple phases. And the article of Zimmerman sometimes feel like overwhelming because this is determining how the prioritize interventions with health risk very clearly and across the phases. For example, what should be addressed first, pre-departure education or safe transit basic conditions. This, I think, isn't always unclear. In the second part, the article by Howard Knight discussion this comparison between different migration contexts. For instance, like Europe versus developing regions, and introduce diverse risk factors that are challenging to be synthesized into a single model. And finally, in the article by Evans, this is have the historical narrative, while informative sometimes plays a past and present in ways that make it difficult to pinpoint which lessons are most applicable today. Continue with the third question. What was new to you and did it change how you think about or perceive the things? Okay, even that I have studied migration and health before, this really deepened me my understanding in other ways. For example, I was struck by the idea that migration is a non-linear event. It's more like a cyclical, multi-phase process. This perspective, especially with the article by Zimmerman, reshaped my view by emphasizing that each phase of migration creates different health vulnerabilities and that policies must be designed accordingly. In another point, like the Evans historical approach provide a broader context, revealing that while the challenge involved many core public health issues that relate to migration remain persistent over the time. And for the last point, Howard Knight analysis, which highlights the interplay of migration, risk, and inequality, made me reconsider the importance of framing migration as a simple personal journey, but most like a structural phenomenon influenced by global power imbalances. Well, with the first question, was there anything you would like to explore further or learn more about, and why? Okay, these readings have me open up to several avenues that I want to explore more, and one of these points is the cross-sector policy coordination. I like to investigate how governments can be better integrate the policies across different sectors like health, immigrants, labor, and security to create a comprehensive approach to migrant health. For example, what type of model exists and that's successfully in the bridge of the gas. Another one is the tailored intervention for each migrant phase. That it will be evaluate to delve deeper into specific intervention at each stage. So it's a pretty picture of the health education programs, safe transit protocols, and support networks and destinations. Understanding which interventions yield the best outcomes in different contexts. That's, I think, is crucial. And the other one is the regional comparisons. This one, since I'm already with some context about these topics, and compare how migration impacts and health in Europe, North America, and Latin America, including Mexico, and how health identify best practices that are adaptable to various socio-political environments. And last but not least, the 5 question: give at least one specific example of an aspect or experiences in your personal or professional life related to the main topic. That's a personal experience. A large part of my family, or my paternal family, migrated from Durango, their home state, to the western of the United States in the 80s in search for a better future. However, I did so as undocumented, obviously without papers. My uncle, actually my father's brother, started to working in construction, specifically in building complex and flooring. And he worked in these fields like 14 years without papers and even having a tourist visa, at least residency. And of course, without the ability to return to Mexico when he wants. Well, so whenever he got sick or feel unwell, it was a moment of panic because he called and go to the hospital to his legal status, and I think that's actually so scared. And instead, he had to really friends who need private doctors that have the willing trade with migrants, or resort to self-medication, especially with AIDS. Fortunately for him, after these years, he was able to obtain a green card, allowing him to travel freely between the USA and Mexico. However, the fear and uncertainty that keep him awake at the night are the same struggles that a million of Latinos living in the United States have and continue to face, living without the access to public healthcare and lacking the freedom to seek a medical treatment without the fear.